future CNAs, I just wanted to take a moment to talk to you about hair. That is right. Whenever you're preparing for your nursing assistant examination or preparing to work in the real world, I want you to repeat after me. Your hair should not impact patient care. Say it again. Your hair should not impact patient care. What am I saying? Pull your hair up. Your hair should not be on your shoulders. I know that my hair is longer, but I'm doing this on video. I know that if I was working in the real world, in patient care, I would not have my hair down like this. Plus, something that I want you to consider is that whenever you're providing patient care, if your hair is touching the patient, look you all, that is an infection control issue. You cannot allow your hair to be touching the patients. Plus, there are psych patients everywhere. There are psych patients in the med-surg unit, in the critical care, in the ER, even in the pediatric hospital. So if you don't want someone pulling your hair, I need for you to move it out of the way. So before you take your test, this is what I want you to do. If you have hair that can be pulled up into a ponytail, by all means do so. So if you don't want to pull your hair up in a ponytail, something that I would recommend that you wear would be a nurse cap. And so you can get these from most uniform stores, but there will also be a link in the description area so you can actually shop on my Amazon store. So I'm going to actually put my nurse cap on because I need you to consider this. Look, you may not want to cut your hair. You don't want to pull it up, but you have to do something because this is not appropriate for patient care. All right, so this is what I'm going to do. I'm going to apply my nurse cap on camera. Let's go. Going to put that on. Going to pull my hair up. Going to put it in. And now if I want to be cute, because I still want to look like a lady, right? I want to be cute. I can just pull a little bit of hair out in the front, like so. But then you all, before I perform care, guess what I do? You're right. I tuck that back. And look, if you also pay attention, is I don't have on any earrings. Now, you don't have to be earring free, but what you can do instead is you can wear studs, because if you wear hoops like these, again, especially if you're dealing with a psych patient, they can pull on your earring and they can actually rip your earlobe. One more thing that I want to talk about is the nails. And so we get that a lot. I know that you all want to wear your nails. I understand that, but again, that is an infection control concern. If you have those long nails on, they harbor germs. On top of germs, when you're providing care to your patients, they can rip through your gloves, or you can actually cut your patient when you're providing care. So I know that is a lot and I sound like one of those old school nurses, but guess what? I am, and I want to keep you safe and I want to keep your patients safe. So hair up, low or no earrings, nails cut down, wash your hands, be that best caregiver. I want to see you in a few years and I want to see you healthy and happy. I don't want to see you injured. And so anyway, that's the end of this video. I hope that this helped. Yeah, I had a rant, but it's a rant that is needed because you can't have long hair impacting your care. All right, bye everybody. Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com.